Hi, everyone. Welcome to the show. I'm Dr. Nicole, and today's show is for those of you who are parenting or working with girls or young women, specifically in the preteen, teen, young adult years. I've seen a major trend in the past decade or so, I would say, of more and more girls and young women being prescribed hormonal birth control, whether it's birth control pills or hormonal IUDs or other kinds of options for everything from regulating periods to managing PMS symptoms to dealing with mood issues, anxiety, kind of all over the board. And I'm a big proponent of women having options when it comes to birth control and medication, but my concern is that most parents and teens are not really being educated about what these medications are, how they work, and potential problems that can come up. And I have seen many patients here at the clinic over the past decade or so who have had major side effects and issues, particularly in the realm of mental health, that have stemmed from hormonal birth control. So I just think these are things that are not being talked about enough. And that's why I'm thrilled that my guest today is my good friend and colleague, Dr. Jolene Brighten. She's an expert on all the issues surrounding hormonal birth control, and I can't think of anybody better to delve into this topic with. Let me tell you a little bit about Jolene. She's a functional naturopathic medical doctor and nutritional biochemist with a focus in women's endocrine health. She's recognized as a leading expert in post-birth control syndrome and the long-term side effects associated with hormonal contraceptives. Dr. Brighten is the author of Beyond the Pill, a 30-day plan to support women on birth control, help them transition off, and eliminate symptoms of post-birth control syndrome. She's a speaker, women's health advocate, and a medical advisor for one of the first data-driven apps to offer women personalized birth control recommendations. Jolene, welcome to the show.
Hey there. Thanks so much for having me. I'm excited for this conversation today.
It's going to be awesome, and this is something that so many parents, when I see them at the clinic, if they've got girls or young women that they're parenting, we start talking about things like what kinds of birth control their daughter might be on or what options have been presented, and really they don't have any awareness or aren't being given any knowledge of what these things really are, what's even going on with their period, what are these medications, how can they be helpful, but also what are some of the side effects and the problems that come up. So I'm excited for us to delve into that.
Yeah, exactly. And that's why I set out to write Beyond the Pill. I did the pill for a decade, absolutely a tool that I use to make my period problems go away and also become a doctor. Like it's a great tool for women to be able to have access to, but really what I saw was missing in my own health journey and with so many of my patients was that true informed consent of understanding what happens when you take this pill. What can you do to monitor these symptoms, to stay safe on it? And what are the individual recommendations that we can be making so that if women start to have side effects, they can mitigate that or decide.
I lost you there for a second. Are you back?
Yeah, I was moving. You weren't moving. I'm so sorry.
Yeah, that's okay. They'll edit that out. Don't worry about that. So let's jump in. I want to just set the stage for this conversation a bit by having you talk briefly about how the menstrual cycle works and what's the benefit of having a menstrual cycle or of getting a period, because I think one of the things that's really appealing, especially to girls now, is this idea that, I can go on this pill and then I don't need to deal with a period at all. So let's just talk about some of the basics of that.
Yeah. And I love that you bring this up because really the question of whether or not to have a period, it really didn't enter until we had new iterations of birth control where we could be on them continuously. And it's something where, in medicine, doctors will say there's this story of you don't need a period, you don't need to have a menstrual cycle, it's not necessary. And then at the same time, the American College of Obstetricians and Gynecologists in 2015 deemed the menstrual cycle and your period and the signs and symptoms that come with that the fifth vital sign, which is up there with blood pressure and temperature, how we know if you're sick or going to die, these kinds of things. So it is something that's very interesting. And I definitely, I don't judge anybody for this. I thought I was pretty clever for 2 years of just skipping periods for whenever I wanted till that little voice was like, wait a minute, this isn't what your body is designed to do. Now, with a menstrual cycle, I will say this is something I set out to write in my book and really help women understand is like, how does your menstrual cycle work? What's up with your hormones? What do they do for you? Because I didn't know this until I got into my first year of medical school. And that's ridiculous. You shouldn't have to go to medical school to understand how your menstrual cycle works. And sadly, that was also after like college physiology classes. So here's the thing. Day one is the first day that we see blood, where we experience a flow. And we measure the menstrual cycle. We start on day one. On day one, what has happened is your hormones have dropped. So your progesterone and estrogen have dropped. That way you shed the endometrial lining. So that's the lining of your uterus. Now, if you're seeing clots, if it's heavy, if it's, brown discharge, these can all mean different things in terms of your health. Like it can be a sign of iron deficiency anemia, hypothyroidism, poor liver detoxification, and making the wrong metabolites, which those metabolites over a lifetime can stimulate and may very well contribute to cancer progression. So this is pretty valuable information to have. Now, around day 3, your brain starts talking to your ovaries and says, let's get a follicle ready so that we can ovulate. That's when FSH picks up, follicle stimulating hormone, and it stimulates the ovaries to get an egg ready, which is going to be ovulated approximately somewhere in the middle of the cycle. Maybe that's day 10, maybe it's day 14 for you. Understand, women, that day 20 or a 28-day cycle is an average, and it looks different for every woman. It's also why the method of just being like, oh, just split your cycle in half and that's when you ovulate, avoid sex then, that doesn't work. You're hearing it here first. Now, you've probably heard it somewhere else too, but so right before you ovulate though, you're going to see an uptick. Estrogen is going to rise, and as is testosterone. And testosterone is going to cause a libido increase. And then what you'll see is that the fertile cervical mucus gets started. And so that is totally normal. I will say I've had women in my practice who were put on the pill at like 14. And then they're in their 40s and they come off, and for the first time in their life, they're like, what is this goop in my underwear? Mm-hmm. That's fertile cervical mucus, 100% normal, 100% should not be anything you're ashamed of. Now, once you're getting to that, like I'm about to ovulate phase, that's when you're going to notice there's going to be a surge of LH, luteinizing hormone, estrogen will peak, you will ovulate. Ovulation is so very important because when you ovulate, what's left behind is the corpus luteum. So in that first half of what I've just described, that's the follicular phase. Some people you'll see will divide up the menstrual cycle in 4 phases, saying your period is separate. But understand that even while you're bleeding, you are getting a follicle ready. And so that's why in medicine, we call it all the follicular phase, because what is the point of that? The point of it isn't a period. The point of it is get that egg ready, come into ovulation. Following ovulation, that's where we go in the luteal phase. Now, luteal phase is where progesterone is the main player. That makes you feel chilled out and calm. You get better sleep at night. I think estrogen and progesterone are wonderful hormones, but when they're out of balance, they're absolute nightmares to deal with. So at the end of this, if there is no pregnancy, those hormones drop again, your period comes back. Now, if in that luteal phase, let's say that you're wanting to scream at people, you're having anxiety. I mean, I'm sure you've seen this where women get put on anti-anxiety medication, and some things are even told, just take this anxiety medication the week before your period because that's when it's an issue.
Right.
And the issue is not that you have a deficiency in this medication, although it can help. The root cause of it really is that you don't have enough progesterone. Is that because you're stressed? Is that because you have an infection going on? Do you have a luteal phase defect where that corpus luteum can't do its job? Are you deficient in vitamin C? Are you not getting enough time with your girlfriends? Like all of these things can impact what's going on. And I say all of this because I think the biggest misconception in women's medicine, and there's a lot actually, is that your symptoms are your body's way of betraying you. And this story of being a woman is inherently awful. So just suppress your hormones, suppress your period, and go on your merry way. When in reality, your symptoms are your body's way of communicating to you. It's an opportunity to unearth that root cause. And, in our young girls, I'm like, this is the time to act now, like not when it like really comes to a head in our 30s and 40s. And I know, okay, so like I had a period that was like 7+ days, incredibly painful. And so if you're a woman who's hearing that and you're like, but I really don't want these symptoms, like I feel you. And if you do choose to use birth control, that doesn't mean you don't keep investigating.
Mm-hmm. I think that that's such a great point, that these are signs, like red flags that our body waves that says something might be out of whack here. And so if you're seeing in your daughters or even, in yourself that, wow, really, really terrible PMS symptoms, really huge mood shifts, can't sleep. Like if your daughter is really thrown off by different cycles, throughout the month, different phases throughout the month, that's an indication that there's probably some actionable things there that we should be looking at, right? And so what you're saying is, instead of just sort of putting a Band-Aid on it and making those go away by using hormonal birth control, that really we can start digging into what some of those underlying issues are.
Yeah. And, it's 100% you're right to use birth control for symptom management, but it's also 100% you're right to have that root cause investigation. And this is something that becomes problematic so young girls. It's not uncommon to have irregular periods when you're getting started here. Like, your brain and ovaries are figuring out how to dance together. You ever see anybody figuring out to dance for the first time and they just like nail it? No, that like never happens. So, it's not uncommon to see that. And there's a researcher, Jolene Brighten, who's talked about how it's really a 10-year maturation process of that brain ovarian connection being solidified. But often young girls will be given birth control for that, or, and sometimes that actually can be because of hypothyroidism, for instance. And so I'll have patients in my clinic, I go through a timeline with them. They're like, yeah, my period was irregular, and then I was like, I always have had dry skin, and like my weight has always been an issue, and I'm someone who just needs to sleep 10 to 12 hours. And you go through that and things are getting worse and worse in their whole timeline. You're like, wow, it sure sounds a lot like you had hypothyroidism. Your period was the first place that presented, and yet you were given birth control. And so everybody said, well, that's a regular period, so go on your merry way, except that it's a medication withdrawal bleed. It's not actually a menstrual cycle.
So you mentioned the irregular cycles, and I think that's one of the reasons that I see of why a lot of girls, young teenagers, teens, young adults are put on the pill. What are some of the other reasons that you see that younger girls, or even at younger and younger ages now, that they're being put on the pill?
Well, menstrual cramps and pain in general. It's estimated that over 30% of women who are taking the pill, that's one of their primary reasons. Now, to frame that, we used to use birth control to space pregnancies. And then this thing happened when I was about in, my early 20s, where it started being marketed as like the pill for every female ill. And so now we see, like you were saying, in the last decade, you're seeing that birth control is being prescribed more and more. Well, from the research, we've come to understand that almost 60% of women state their primary reason for going on the pill or using any kind of hormonal contraceptive is for symptom management. So menstrual cramps and pain is number one. And definitely, nobody wants to be in pain. And so I can understand that. But like, what is that pain? That pain is often an issue with inflammation, prostaglandins, estrogen. It also can be related to the gut. So again, there's a root cause to all of this. And, for women who are listening that say, well, what about endometriosis? It's interesting because endometriosis is cited as about 4%. Now, I think that number, the reason why it sounds so low and it's like, wow, no, wait a minute. Like if you're saying it's pain, it should be higher, is because when you use the pill to treat symptoms, you often delay diagnosis. It's to me that the girl hormonal birth control, and the longer she stays on it, when she's put on it for pain, the higher the probability that she has endometriosis. And so I don't think that's because, so there's people out there that are like, that's because the pill causes endometriosis. I don't think we have a research and evidence to say that. I think it's more that this gal presented with these painful periods. She was then put on birth control. And when she decided to have a baby, that's when it was uncovered. Now, and why is it uncovered then? Because endometriosis is responsible for about 12% of infertility cases. Now, irregular periods, that's also up there with the painful periods. Acne is another one. And this is the one that gets me, where I'm like, you're treating her for acne. And sometimes this is for a woman with polycystic ovarian syndrome, like irregular periods and acne. But hormonal birth control puts her at higher risk for stroke, heart attack, having a clot, something that PCOS women are already at higher risk for. But in addition to that, when you're treating her for acne, with something that nobody dies of, with a medication that's something people do die of, are you having that discussion of, are you helping her really make that decision and understand what to look out for? So those are some of the top reasons. Over 10% is unspecified reasons that are related to hormones. So that might be that you're having hair loss, you're having hair growth on your chin, chest, abdomen. It also can be an issue with headaches, which, is very concerning. I was actually having a discussion with a mutual friend of ours, Dr. Maya Shatreat,
Mhm.
about how often we see doctors prescribing the pill for migraines, although we have known for a very long time that a migraine with an aura is a contraindication because she's at higher stroke risk. And yet this is still a treatment that's being offered.
That's a great point, and I've seen that, more often than I should in practice too, of even teenagers who aren't having any problem, young women who aren't having any problem around their periods, but being put on hormonal birth control because of, migraine issues, mood issues are another one that I see often, where it's like, well, we've had, this young woman on an SSRI medication for depression or those kinds of things, and it's just not getting better. So, let's throw a birth control pill at it and see if that will, help manage the mood. And what I see is a lot of young women who have been on hormonal birth control for various symptoms for a while, and they're coming in because those problems still aren't solved, right? It's like I'm taking all these medications, including birth control, and still I'm having these issues. And, you made a great point about how the pill can mask important physical symptoms and things. And I look at that too, that it can mask important emotional things and traumas and things that people are experiencing, that young girls and young adult women are experiencing, that need to be dealt with, and not just shoved under the rug and said, well, you're having hormone issues, you're feeling, down or anxious or whatever because of this, let's put you on the pill. Sometimes what I find is that then really makes it so that these young women are not getting the help that they need for maybe things that are going on in their life that somebody needs to look at and address, or learning coping skills or things like that. So I think these are red flags both for physical and emotional issues, and we can use the pill as a Band-Aid, but really what we want to do is get to what are the root issues that are causing these things.
Mm-hmm. Yeah. And like you were saying, I think hypothyroidism we're seeing this more and more in young women. And like, do you remember the time where like, it was like hypothyroidism, that's something that women in their 40s get.
Right.
And then it's like now women in their 30s. And now we're seeing 8-year-olds with
Right.
Hashimoto's. Like,
Yes.
what is going on? The canary
Yes.
in the coal mine is what's going on. But
Yeah.
that alone is something that can present with like anxiety or depression or alternating.
Mhm.
And, it's interesting to me that you talk to psychologists and psychiatrists, and they will say, well, if that medication didn't work, you should be definitely looking at thyroid. And yet we'll hear from primary care physicians who are just prescribing mood altering medications over and over and not investigating that. And I think it's just really interesting that the people who have the training in mental health recognize thyroid, and yet there's this disconnect within the conventional medicine paradigm on that.
Yeah, excellent point. I want to delve into mental health risks for our preteen girls, our teen girls, our young adult girls, because I have yet to have a patient come in who has received any information from their prescriber around this. And I really think it's important that you're talking about it. So what do we know about mental health risks for teenage or younger girls who are on hormonal birth control?
Yeah, let me say this too. For every woman listening, like odds are you've been dismissed at some point with something that you've brought to a doctor, because medical gender bias is well recognized and documented. And what's interesting to me, like you were saying, doctors will say, okay, you are having your hormones fluctuating in your menstrual cycle are causing your mood symptoms, so I'll put you on hormonal birth control. Then when you say they're worse, they say, well, that could never have an effect because there's no study on that. But it's like, just use a little bit of logic there. Like, you just use this medication, these synthetic hormones, which, by the way, your gut has never seen before. Your brain doesn't know. Like, we didn't evolve with synthetic progestin. Like, that's just not the reality of the human body. So I think it is something where, it's important women to recognize it's on the package insert. It's something women have complained about since the introduction of the pill, and yet it is one of the most commonly dismissed side effects.
Mm-hmm.
And even when we saw a study come out of over 1 million women in 2016 saying, hey, if you get prescribed birth control, you're 23% more likely to also get prescribed an antidepressant because you go on to develop depression. And yet scientists and doctors lined up to dismiss this. And I'm like, when you dismiss that, you are dismissing a woman's story. Okay. And I get that, like, maybe the research wasn't done exactly the way that you want to see it. And we're not at a place where we can say causation. Like, we can only say correlation. based on a relatively new scientific method of researching the human body and in medicine. I mean, that's the other thing we can come to understand is all this evidence-based medicine, it's fairly new on the scene as well. And I don't think it's at a place to really understand the complex nature of being a woman. We are not as biologically simple as men. And why would we be? We make humans, we grow them in our body. So for our teen girls, what was really the most concerning coming out of that is that they were 80% more likely to develop depression when taking the combination pill. So that's estrogen and progestin, which then some people said, and let me just say, progestin's made in a lab, progesterone is made in nature. They are not the same thing. If you understand that, you are way ahead of most experts in this arena. Now, there were people who then were like, well, it's probably the estrogen. And then what we came to find out is that, if you're on the progestin only pill, you're 34% more likely to be prescribed an antidepressant. That was higher than the combination pill, which was 23%. Teens taking progestin only, which is commonly called the mini pill, had a twofold increased risk of depression. And then it only gets scarier because if you're using hormonal birth control as a teenager, you have 3 times the risk of committing suicide, which really peaks in the, well, let me say, no, that was young women. The teens actually had double the risk of suicide after 1 year on the pill, and they were 30% at higher risk for 7 years on hormonal birth control. Now, the suicide risk peaks in the first few months. And I really want to, I want to highlight this and spend a little time here because we are in an age where a girl can go get the pill and her mom never knows about it. Her family never knows about it. I would never advocate for women not to have access to that. I was in a super religious family. There's no way I would have been able to ever been given permission to start birth control. However, if you notice your child is not motivated, they don't want to talk to their friends, they're starting to cry all the time, they're raging out like the Hulk, and because it's like everybody always thinks depression is like, you're just sad. And no, it can show up in a lot of ways. But if you as a parent notice anything is not normal and you have a teen that possibly did go start the pill, this is something to give pause and pay attention to. And it's something I'm really concerned about because I think that if a doctor is going to pass a girl the pill, and when I say girl, any woman, there should be this conversation of what could be the impact on your mood. But especially with these teenage girls, if they're going and their parents are not aware of their contraceptive choices, that should really be a dialogue the doctor has, and should say your bestie should keep an eye on you for the next 6 months. And I actually want to check in with you. I want to check in with you in 6 weeks. I want to check in with you again in 12 weeks and see how you're doing, and do a little mini mental health screening because these girls are really, really high risk. I mean, being a teenage gal, I mean, you cry enough as it is.
Right.
It is enough. I think back to my teenage self, but I went through a pill that I remember when I started it with my doctor. I remember I would get in the shower and I would just cry and I would be immobilized. I couldn't get out of the shower. And when I went to him and said, the only thing that's changed is his birth control and maybe it's this, he was like, no, but I'll put you on a different pill.
Yep.
And then everything changed. And how many women have you talked to that's happened? And time of out for if your daughter, if something's going on, don't assume it's a bad breakup with a boyfriend. Don't do what most of society has done, which is brush it off and say it's something else.
Yep.
Definitely take a moment to pause. Could this possibly be involved? Because this is a real risk. I mean, to think that you get, and these days you can get it in the mail and never talk to a doctor. And to think that you can get this medication, you can start this, and no one would ever told you, hey, this could be impacting your mood. And then the next thing you know is you're having suicidal ideation. You're thinking about taking your own life.
Yeah. So important. The statistics are really staggering, actually, and just so vital for us as parents to understand. And, I've had several moms over the years come into the clinic who have raised with their child's prescriber, gosh, things seem to be worse, whatever. And they're told exactly what you're saying. No, it's not the pill, or we can change the type of pill. And I think where it becomes even more complicated, and for those of you who are listening who have daughters who already, have a history of things like depression or some kind of mood disorder, anxiety, those types of things, and they've been put on the pill either for contraception or to manage cycles or as part of, you know, their treatment for those mental health issues, the picture gets really complicated, right? Because it's like, my kid already had some of these issues. Now, you know, what's causing an increase in it? But I think anytime you start your daughter on something, even birth control, even, you know, an antibiotic, anything. And we tend to think, oh, well, that's not related to their mental health stuff. It's all related. And what I hear you saying is this is all interconnected, and absolutely hormonal birth control can have an impact on either initiating mental health problems that weren't there before or worsening them, and that we need to really be aware of that. And we need to be watching for ourselves and our daughters and advocating then for them with their prescribers that something doesn't seem right here.
Yeah. And as I go into, I have a whole mood chapter in my book, you know, what I really appreciate. So at this point, I think we need to stop debating, does hormonal birth control impact women's moods? Like, there are enough women who have said this, that have said yes and raised their hand, that really, I don't care if we can say causation, correlation, whatever. Can we just start believing women's stories and instead take the approach of, why her and not her? Like, why does that happen to this person but not this other person? Because we all have somebody in our life who's been impacted, and you hear these women say, like, I can't do hormonal birth control, it makes me a crazy person. Why did it affect her in that way? And I really respect that study came out and the researchers were like, we're not going to sit here and debate causation. We just want to understand what's the possible mechanism of action to this. And one thing they found was that the inflammatory effects of hormonal birth control, the way it affects the female brain, led to an increase in neurotoxins being produced in the brain. So while you're on it, you actually make toxins to your brain. And so, you know, when I've had doctors who kind of push back on this, and you know, I'll ask them, like, okay, so if you subscribe to the serotonin theory of depression and you believe that it's a deficiency in serotonin, then can you understand that if you're on a medication that depletes the nutrients you need to synthesize serotonin, how that might play a role? That's usually a moment where the light bulb goes off for them, because this is something they've been taught in school, is that if you're deficient in serotonin, then you're going to have depression. And so if you're on a medication that, I mean, research has been showing for decades, you need more tryptophan if you're on hormonal birth control. Well, that's precursor to serotonin. The problem is that, you know, if you look at the cytokine theory of depression, what you do with that tryptophan is what becomes problematic. And so, you know, no matter what you subscribe to, there is logic, there is basic physiology that you can look to and have the answers, that we don't have to wait decades for a study to come out, for someone to fund a study, and then for doctors to hear the study and then believe the study, for us to start believing women.
So true. Absolutely. So we've talked some, you know, you talked about getting to the root cause issues. So that may be a reason that some parents opt to not use hormonal birth control for their daughters, because they want to delve into, you know, root causes and investigating that with appropriate medical professionals who can help them do that. Let's talk here before we have to end about what about for parents and young women and teens who do choose to use the pill for whatever reason, whether it's regulating, you know, cycles or for mood issues or whatever. What can they do? What should they know about how they can better maintain their health while using hormonal birth control?
Yeah, that's a great question, because, you know, it's not for us to decide what a woman does with her body. And no, I have a boy and I still have fear of teenage pregnancy. Like, I think that parents, it's just like, that fear is real. And so I definitely have parents who reach out to me and they're like, I feel like the pill is the thing my daughter's going to be most successful with. Well, someone needs to also talk to her about how she uses it, because if it's not perfect use, it's only 91% effective. And so keep that in mind as well. Now, if you choose to go that route, you know, the first thing I recommend is to at least spend one, if more is even better, but at least one menstrual cycle documenting all your symptoms. Going through, just as we explained at the very beginning, so go back, listen to the beginning of this again, and go through what's day one like for you, what's day two, like go through the physical and emotional symptoms, everything you go through, so you know your baseline. I also think it's important to get lab testing. And there's doctors out there that are like, we just test if there's something wrong. Why are you waiting so long to get someone's baseline? Like, how would you know they're normal if, like, you're only basing it on when they get sick? And so getting a thyroid panel, getting a CBC, looking at a homocysteine, so you know right now what are you doing with your B vitamins. Like, And I go through all kinds of labs in my book that you can get those baseline labs. Then when you start hormonal birth control, you need to be on a prenatal or multivitamin because it's very hard to out diet these nutrient depletions. You still need to eat a whole foods diet. But, when I was a teenager, I thought crumb donuts were acceptable lunch. So like, I'm like, let's be realistic about what might go down. Because I think we have to do those moments of what I call the metabolic obscenities where you're cussing at your body with your food. So, with that, getting a good prenatal or multivitamin on board so that way you can safeguard against nutrient depletions. As much as we can get our teens eating fibers and nourishing their microbiome, awesome. But probiotic is going to be a good idea as well. Hormonal birth control really hits the microbiome about as hard as an antibiotic does.
Wow.
And I know when I read the paper that was like, the effects of hormonal birth control, so the pill specifically, is similar to that of an antibiotic. And I was like,
Oh,
whoa, but who spends 10 years on an antibiotic? Like,
right. That's
this woman
incredible.
did 10 years on an antibiotic.
Yeah.
Uh,
Wow. Okay.
yeah, no. So that's what it's been likened to. And it causes intestinal hyperpermeability as well, which is leaky gut and
Mhm.
sets the stage for potential autoimmunity. So the other thing you should know is that if you have a family history of inflammatory bowel disease or Crohn's disease, you're going to want to give pause before you start that, because what they found, a Harvard study found that 5 years on the pill and a family history of Crohn's, you were 300% more likely to develop it. Like, that
Wow.
is really something to give pause. So going through your family history before you start it, and then continuing to monitor your symptoms through the lens of your personal and family history. And I will say this, especially with mood, you start to get a little anxious, you start to get a little weepy, you feel a little bit angry, like it's even a little bit, you need to talk to your doctor, because what happens is that it starts out subtle because your body's so adaptable and super, super smart, keeping you safe. But then what happens is a year later, you can't handle it anymore. Adaptation is failing. And at that point, your doctor says, well, if it was birth control, it would have happened by now, but it's been too long. So it's something else. And really the reality is that it's that, the female body in particular is really amazing at pushing through pain and discomfort and dealing with a lot of things. It's why there's humans here. There wouldn't be humans if we didn't have that capacity.
Right.
So there's, getting your diet dialed in as best as possible, trying to get, the broccoli in, the cruciferous vegetables to support liver detoxification, bringing on probiotic rich foods or even taking probiotics, and then, getting that prenatal and multivitamin. That is all really helpful. But one of the best things you can do is continue to ask what is true for you and monitor your symptoms throughout. And, I'm sure you're aware of this, as most female medical professionals are, that women have been dying of heart attacks at a higher rate than men. We are more likely to be dismissed with chronic pain and significant conditions than men are. And it is something that has hurt us. And so in Beyond the Pill, I go through like, what does it look like to have a heart attack for a woman? What should you be aware of? And I will say I've heard from so many doctors who are like, oh, the stroke risk is so low. Clots are so low. Why would you even worry about it? Well, I go through specific lab testing that you can have done to know, is that true for you, and understand that. But I've also had 19-year-olds. I've had 20-somethings come into my office after having a stroke on the pill and then being told, well, just do the NuvaRing or do the patch or do something else. And some of them, their doctors are like, nope, this is a deal breaker. And there's a lot of really, really great doctors out there. I want you to get the idea that I'm being like, oh, doctors are the worst. No, no, no. There's really, really great doctors, but it may not be within their wheelhouse with what you're dealing with to be able to hear and understand that. So those are like the big things. And I cannot iterate enough that like, you live in your body. And so you know what normal is. And if you feel like it's not normal for you, it doesn't matter what your doctor says. Doctors will say, this is your new normal. I'm on a medication that created this new normal. Maybe we should pause and question it.
Mm-hmm. Awesome. Such great practical things that parents and girls can be thinking about in terms of what they can do. And I love that message about being in touch with what is true for you and not just letting people dismiss. And for parents and for young girls and young women to feel empowered to advocate for themselves and to keep searching if you need to find the provider that's going to listen and going to look at what's really going on for you and not just dismiss that. I think that's such a powerful message. The book is Beyond the Pill. It's out now. Tell us, where can people go to get the book? Where can they go to find out more about you and what you're doing in the world?
Yeah, so you can find me at drbrighten.com. That's my main hub, DRBRIGHTEN. I also play on Instagram at Dr. Jolene Brighten, and I have a YouTube channel where I seek to educate people in a different way because not everybody wants to read big articles like you and I do.
Right?
We all learn differently, right? And then you can pick up Beyond the Pill everywhere that they sell books. If you grab it, I got some gratitude gifts for you at beyondthepillbook.com. You can go over, grab some exclusive interviews, some recipes, lab guide that you can check out. So you can start supporting yourself now, whether you're on birth control or off of it. And the book's called Beyond the Pill because I knew from my years of practice that you can go to your doctor with any lady parts problem and they will offer you the pill. I wanted to give women a solution beyond birth control, but also provide them support if they decide to do it and when they're ready to transition off.
Awesome. Such an important book. We've been recommending it so much here at the clinic. For those of you, for us to use as moms, for ourselves, for our girls, our daughters, our friends, all of that. Just an amazing book. So I highly encourage people to check that out and certainly to follow you on Instagram and everywhere else. So thank you so much. Really important, really informative interview. I learned a ton. So thank you for that. And we appreciate you spending time with us.
Thanks so much for having me and for all the work you do. Like, we need a lot more docs like you.
Thank you. All right, everybody, that's it for this episode. We will see you next time for our next episode of the Better Behavior Show.